Welcome to aminacademy.com and questions how, why, and what. And that we'll discuss about what is antibiotics, how does it work. Antibiotics are powerful medications that treat certain infections and can save lives when used properly. They either stop bacteria from reproducing or destroying them. Before bacteria can multiply and cause symptoms, the immune system can typically kill them. White blood cells attack harmful bacteria even if symptoms occur. The immune system can usually cope and fend off the infection. However, sometimes the number of harmful bacteria is excessive and the immune system cannot clear them all. Antibiotics are useful in this scenario. The first antibiotic was penicillin. Penicillin based antibiotics such as ampicillin, amoxicillin, and penicillin G are still available to treat a variety of infections and have been in use for many years. Several types of modern antibiotics are available and they are usually only available with their prescriptions in the countries. Topical antibiotics are available in over the counter OTC creams and ointments. How do antibiotics work? There are different types of antibiotics which work in their unique way. However, the two main they work include a bacterial antibiotic such as penicillin kills the bacteria. These drugs usually interfere with either the formation of the bacterial cell wall, or its cell content. A bacteriostatic stops the bacteria from multiplying. It may take a few hours or days after taking the first dose before people feel better or their symptoms improve. Why is it important to take antibiotics when needed? Experts advise using antibiotics only when they are needed. This is to ensure that the bacteria is killed and is unable to multiply and spread to other parts of the body. Also, antibiotics use can sometimes be associated with side effects and antibiotic resistance. Now, we'll discuss further detail about what are antibiotics and how does it work. Look at here. Antibiotics are medicines that treat or prevent bacterial infections by killing bacteria or making it difficult for them to grow and reproduce. They can be taken orally, topically, or through an injection or intravenously IV. Antibiotics are used to treat a variety of infections including ear and sinus infections, dental infections, skin infection, meningitis, strep throat, bladder and kidney infections, bacterial pneumonias, and whooping cough. Antibiotics are not effective against viral infections such as colds and flu, the most coughs. They should only be prescribed when necessary, and you should follow your doctor's instructions carefully. Unnecessary antibiotics can be harmful. Some side effects of antibiotics can include vomiting, nausea, diarrhea, bloating or indigestion, belly pain, loss of appetite, hives, coughing, wheezing, tight throat, or trouble breathing. Alexander Fleming discovered the first antibiotic penicillin in 1928. Fleming was a bacteriologist at St. Mary's Hospital in London when he noticed a zone around a fungus on an agar plate where bacteria did not grow. He isolated the mold and named the active agent in it penicillin. Challenges. Fleming's effort to purify penicillin were unsuccessful. He sent the penicillium mold to others in the hope they could isolate it, but interest wanted in this early 1930s. Introduction. It took over a decade before penicillin was introduced as a treatment for bacterial infections. Here are some facts about antibiotics. Further about antibiotics. Antibiotics are essential tools for treating bacterial infections and preventing their spread in people, animals, and crops. Antibiotics are only effective against bacteria and they won't help with their viral infections like colds, the flu, or most sore throats. Antibiotics can have side effects. Side effects can range from minor to severe and includes rash, nausea, diarrhea, and yeast infections. Antibiotics can contribute to antimicrobial resistance. When antibiotics are used unnecessarily or when the prescribed course is not completed, bacteria can develop resistance to the drugs. In the US, more than 2 million people get antibiotic resistance infections each year, and at least 23,000 die from them. Antibiotics are not always needed. You should not take antibiotics for every bacterial infections, and some ear infections and sinus infection does not require antibiotics. You should always finish your course of antibiotics. Even if you feel better, you should finish your entire course of antibiotics to prevent bacteria from coming back. The term antibiotic comes from the Greek words. The word antibiotic comes from the Greek words anti meaning against and biotikos means fit for life. Antibiotics works by killing bacteria and preventing them from multiplying common. Antibiotics include gentamicin, cefaloxin, ertapenem, erythromycin, ciprofloxacin, and metronidazole. They include a range of powerful drugs used to treat diseases caused by bacteria. Antibiotics cannot treat viral infections such as cold, flu, and most coughs. This, this article explains that antibiotics are how they work, potential side effect, and antibiotics resistance. The facts on antibiotics. Now, quick facts we summarize. Alexander Fleming discovered penicillin, the first natural antibiotics, in 1928. Antibiotics cannot fight viral infections. Fleming predicted the rise of antibiotic resistance. Antibiotics either kill or slow the growth of bacteria. Side effects can include diarrhea, upset stomach, and nausea. Here, here are some facts about antibiotic resistance. What is antibiotic resistance? Antibiotic resistance occurs when the bacteria develop a defense against antibiotics, making them unable to kill or stop the bacteria's growth. This is called a resistance of antibacterial causes. The main cause of antibiotic resistance is the overuse of antibiotics. When the antibiotics are used, some bacteria die, but resistant bacteria can survive and multiply. Infections caused by resistant bacteria can be difficult or impossible to treat and may require more care, longer hospital stay, and more expensive antibiotics. Resistant bacteria can spread to other people in hospitals, at home, or through travel. Global threat. Antimicrobial resistance is a major threat to public health, killing millions of people worldwide each year. Economic impact. The World Bank estimates that Antimicrobial resistance could result in trillions of dollars in additional healthcare costs and GDP losses by 2030. Prevention. To prevent antibiotic resistance, healthcare professionals and patients should ensure that antibiotics are only prescribed when needed. Antibiotics versus viruses. Antibiotics only work against bacteria, not viruses like the flu or cold. Taking antibiotics when you don't need them won't make you feel better fast. So far, we discussed about some detail about antibiotics. We have done. Please subscribe our YouTube channel.